Dear brothers and sisters, in our ongoing support for humanitarian aid efforts in Armenia, we are pleased to be reassured from time to time that our donations are put to good use and that certain knights and daughters go above and beyond the call of duty. One such daughter is Dr. Jane Mahakian, founder and provider of Alzheimer's Care Armenia. She is here today to offer a brief history of the project and provide some updates on the accomplishments she and staff have been making and how we can get more involved. So please welcome our own Dr. Jane Mahakian.
Thank you so much, Mike. Thank you very much. Thank you for inviting me here today to present on Alzheimer's Care Armenia. So our mission is to raise awareness and visibility in Armenia around Alzheimer's disease and other dementias. The charity was founded in 2017. And since 2017, we've been pretty much creating a lot of visibility, awareness, education, and training around the disease, as well as how to care for the person that has an Alzheimer's disease, as well as a variety of other different initiatives and services and programs, which I'm going to get into shortly. So our board of directors includes physicians, psychologists, social worker, researchers on the East Coast, as well as here on the West Coast. This is a video that I'd like to share with you that was recently developed.
Alzheimer's disease affects millions of people around the world. Alzheimer's disease affects millions of people around the world, and Armenia is no exception. But because many in Armenia still believe that memory loss and confusion are simply a part of aging, they don't realize that these symptoms could be part of a more serious condition. Spreading awareness about the importance of Alzheimer's screening and diagnosis is a significant challenge in the country. During the COVID pandemic, Alzheimer's Care Armenia President Dr. Jane Mahakian spearheaded the development of a national dementia plan in collaboration with the Ministry of Health to spread awareness about the importance of screening and early diagnosis. With initiatives like developing memory care cafes in every region of the country and the Davos Alzheimer's Collaborative Brain Health Armenia project, teams of healthcare professionals from the ACA have been traveling throughout the country, working tirelessly to educate physicians, nurses, and citizens about the signs and symptoms of Alzheimer's disease, developing in-home health care and dignified end-of-life care programs for patients and family members, and in partnership with the Armenian Eye Care Project, conducting memory screenings for everyone who comes through their doors. When a loved one is diagnosed with Alzheimer's, it can be devastating. Early detection has been shown to be a crucial component in providing patients with the care and support they need to live their best lives and prepare families for the challenges ahead. So please join us in supporting Alzheimer's Care Armenia. Together, we can make a brighter future for all Armenians, but we can't do it alone. The ACA needs your help to expand these programs across the country. Please visit alzheimers.am to learn more about the ACA and our services, find out how you can get involved, or donate to add your voice to our mission to promote Alzheimer's screening, diagnosis, and treatment across the country. Alzheimer's Care Armenia, fighting for a future without Alzheimer's disease.
Thank you, Ken. So there's no doubt Alzheimer's is in the country, right? Up until 2017, very little really was being done to identify people that have a cognitive impairment. And as you know, dementia and Alzheimer's is worldwide. The accomplishments of Alzheimer's Care Armenia I'll talk a little bit about them. During the COVID pandemic, I created a work group to develop the proposed national dementia plan for the country. Every country should have a national dementia plan, like the United States has one. Armenia did not have one. Right now, there are 30 countries that do not have plans, but they're working on them. So I formed a work group, and together with the Ministry of Health and Ministry of Labor and Social Affairs in Armenia, we got together, and we formalized a plan. And this past March, I was in Armenia, and the plan was formalized and was signed, and now the country has a plan for preparing protocols and setting standards of care for people that have a memory impairment. In 2021, I met a young man from Expert Technologies who was using the Robin the robot with children in Armenia and also in Los Angeles at UCLA. And I said to Garin, wouldn't it be wonderful to use your robot with elders? And so I conceived the idea of using the robot with elders with depression and dementia at North Old Age Home in Armenia, in Yerevan. And the project was funded by the Hovnanian Family Foundation. And as you can see now, that project was a huge success. Robin is now in Huntington Beach in an Alzheimer's facility, a day program. And Robin is also, I believe, in another nursing home in Los Angeles. So Robin is now here in California working with elders. We also created a guide. It was the first guide for caregivers, families caring for a loved one with dementia, and over 10,000 of these guides were distributed in Armenia. And we've been very busy creating different memberships and collaborations around the world, really. This past year, in 2022, I developed a project called the Brain Health Armenia Project. And what it is in collaboration with the Armenian Eye Care Project, it's an early detection countrywide mobile memory screening program. And this memory screening program to date has screened over 4,100 people. So over 4,000 people have been screened for dementia. It also trains primary care doctors on how to screen their patients, and also a little bit about what is Alzheimer's disease, what do you look for, what are the signs, what are the symptoms. So that has been a tremendous success this past year. That program ends June 1st, so it's right around the corner. I have a team of 12 in Armenia for this specific project, the Brain Health Project. One of the issues that has come out of the Brain Health Project is, well, what do we do with all of the people that are caring for their spouse or their parent or grandparent? So we launched a memory cafe, the first memory cafe in Armenia. We're going to be launching one next week in Gyumri. What is it? It's like a table like this, and it brings together the person that has dementia as well as their family member. And it's a social group, but it's also a cognitive training group. And they meet once a week, and it's just been tremendous. So we were thinking, out of the box, how do you create visibility in a small, it's kind of like Armenia is so small. We could really become a model for other countries, what we're doing here. So how do we get the word out? And so we had an idea, the team and I, we're going to create a national radio show. Our board thought it was brilliant. And so now every week we have a show about healthy aging in Armenian on this national radio station in Armenia. And then in 2020 and 2021, I developed these healthy aging memory clubs at Oran, with Armenia Hovanesian, at North Old Age Home, and Mission Armenia. And they're really fun, and they're well attended. 20 to 25 elders get together every week at these three facilities, and they do games, they have refreshments, they do brain games, they do puzzles, they do all kinds of fun stuff. And then, we realized the phones were starting to ring. Well, why not formalize it? So just like United States, Armenia now has a caregiver helpline. It's a national Alzheimer's caregiver helpline that is managed by Mission Armenia. Not that they need something to do, because they're very busy and successful also, but their psychologists manage that phone line. And then, of course, being appointed to the Mental Health Coalition is important. This project has really put dementia on the map in Armenia, this brain health project. It's been truly amazing. What has happened is around 1,400 people have come to the eye care project. Our team of doctors, I have 4 physicians on my team, they have screened the patients coming to the Armenian Eye Care Clinic. It is truly amazing, because what we're seeing now is around actually 34% of the people coming to the eye care clinic have some kind of cognitive impairment. It's huge. It's huge. Of the 4,100 screened so far, 33.1% of them have some problems with their memory. So now what we're doing with the eye care project is we're taking it a step further, and we're going to start looking at the biomarkers of these 1,400 people at the eye care project. And what does that mean? Well, I'm not sure yet. But what it can mean is that looking at their eye scans, their fundus eye scan, and analyzing it, as well as further testing, we may be onto something super big, that we can now detect Alzheimer's through the eye. The eye and the brain is very close, right? So that's where we are with this. And then there are, as I had said earlier, there are around 1,500 primary care doctors in the country. We have trained about 650 of them so far, including some nurses on Alzheimer's disease and early detection. So this is some of my members of my team. 3 of them are physicians, a psychologist, social worker, and then my program director, who's been my program director for about 4 years now. That's Ophelia on the right. And some of you may know Lena Nashanyan. She's the deputy minister of the Ministry of Health, and she had a perfect score on her memory screening test. And she was very happy that day to score so well. So we thought we'd share a photo of her. And opening day, one of our board members in the middle, Nancy Barsamian, some of you may know her, that's Anthony Barsamian's wife in Boston. She was visiting Armenia and did quite a lot of training with the nurses there. So this was opening day of our memory cafe. We had about a very good turnout. In the very back is one of the senior specialists with the Ministry of Health, who's been instrumental in helping and supporting our initiatives and programs and services. This is a photo, a very, 4 of our Memory Cafe participants. In the middle is one of the Birthright Armenia volunteers. We have a relationship with Birthright Armenia, and we're very fortunate to have their volunteers help on our program and doing a variety of many different things. And we don't have an office in Armenia right now. We do not. We have a mobile van that cruises around Armenia and does memory screening countrywide. There is some conversations, and there's a possibility of our having the development of an office at Avon Mental Health Clinic. We have applied for some grants. And if we are fortunate to have the grant, then we will have an office by the end of the year, office space, like private office space, which is truly going to be fantastic when we do intakes. So this is the doctors with the Brain Health Project. One day they decided to take a photo, and they shared it with me, and they were out in a village when they took the photo. So this is where we're going. The June 1st is coming up right around the corner. Phase 1 of the Brain Health Project will end. Very successful, very successful. So what do we do? Now we've identified 4,100 people in the country. Now what? What are we going to do with these people? And there's more than just 4,100 people, right? So of the people that have tested positive, the 33% of these people, of the 4,100, what are we going to do? We're going to launch a countrywide in-home cognitive and healthcare program that includes palliative and end-of-life hospice care. I have a work group here that includes Nancy Vartan as well as Sona Hosepian from Los Angeles to work with me, as well as a physician in Canada, Dr. Harag Hamboyan, and then a neurologist in San Francisco, Armin Mugamian, and together we have developed this model of care. So we're very hopeful we will receive the matching funds. Right now we've been promised by the Hovnanian Family Foundation of matching funds. If we can match these funds, then we can begin and launch this September. We're going to continue with our memory screenings with the Eye Care Project and roll around Armenia and screen more patients. And we're going to continue with our training of the doctors. And we are, as I said, in a week and a half, going to expand the Memory Cafe to Gyumri. Our goal is to have 6 memory cafes in every region of the country, which is really awesome. It's a really cool thing. So this is a wonderful picture. It was a training in a park one day by a visiting neurologist from Peru. So I want to thank you for inviting me here today. This is the type of program that affects, and the services affect all of our lives. Alzheimer's is everywhere. Either it's in our family or we know someone that has the disease. There are many opportunities to support us, such as supporting maybe one of our memory cafes, contributing and helping with the expansion of the phase 2 project for this fall by helping us match the funds. So we're excited. This is a 7-day-a-week endeavor. It's something that we can't do alone. I can't do it alone. I have an amazing team in Armenia, as well as an amazing board here in this country. So thank you very much for this opportunity. And if you have any questions.
How did you decide to manage the cafes? You selected Yerevan first and then the second largest city, Gyumri. Do you go by the size of the city?
That's a good question. We're going by how many people are testing positive and that positive on our memory test. So Gyumri was next. We're actually going to have another memory cafe open soon in Yerevan. So we'll have 2 because there's many people. We're finding too, it's not only Gyumri has a lot of positive rate of dementia, but also the other villages have higher rates than Yerevan. So in the villages, there's a higher rate of cognitive issues than in the city.
And why is that?
It's a very good question. It's a very good question. There are many different variables, but one is the level of education is not as high. Number 2, it could be, and we're looking at these variables as we're doing our statistical analysis, which is still ongoing. Over the summer, we're going to be taking the 4,100 people and doing quite a few analysis on the data. Because it's not just the memory test that we have the data, but we've done an extensive healthcare questionnaire. So we can look at the variables and see. But from what we're seeing right now, it's diet, and also cardiovascular problems Higher.
By
higher and diet related to diet.
Alzheimer's seems to be a product of modern medicine where, we live longer for various reasons, diet included. But in Armenia, we're some of the longest living people on earth, right? So is there something that's changed in the Armenian society in modern times that's led to maybe more cases of Alzheimer's?
Well, you bring up a very interesting point, Ty, because up until Alzheimer's Care Armenia, which is really the Alzheimer's Association of Armenia, that's what we are. Nobody has looked at the prevalence of dementia in the country. Nobody knows up until this work. So no one has an idea of what it looks like.
So it may have been around more than
my sense, correct. Correct, because the work had not been done. So
yeah, there's not a lot of junk food and all these other
that's
things.
right. It's very that's right. Correct.
I think the power has something to do with the rest of the issue. People are so poor. That was my impression of Armenia. For many times talking to people, they have absolutely no idea about the rest of the world. That doesn't mean that they're not suffering from unknown diseases. Alzheimer's could have been, or probably is. So if they're not educated, they know nothing about anything. They're barely surviving, literally barely surviving, because the city management is down to pits. Everybody's stealing from everybody else, and the poor people are having more and more difficulties maintaining a passable daily life. If they have some kind of disease, are they going to see a medical facility? If there's one, could they afford it? Most of the time they cannot.
Yeah, that's correct. And you brought up an interesting point. Around 6 months ago, we received a call from a daughter, and she was living in a small village near to Yerevan, very close. And her father had taken to his bed. He wouldn't get out of bed. And he was depressed, he was shutting down, and she didn't understand what was going on with him. So our team of physicians, 2 of them came over along with the social worker, met with him, and what they observed is that and the daughter explained, well, his eyesight is going. And is that related to the dementia? My father has dementia. And so we made recommendations for him to be evaluated by our Armenian Eye Care Project. And so we took the gentleman in our van, they had no transportation, and took him to the clinic. And sure enough, what happened was that he had like some severe cataracts. Cataracts so bad that he could no longer see. But because of his dementia, he could not express that. So the Eye Care Project, he had the surgery with the Eye Care Project. And then we also noticed that he was hard of hearing. So we were able to secure the hearing aids for him. A month later, and our team was working with him, making house call visits. A month later, this man was out of bed, higher functioning, and his cognition improved. So his name is Hamlet. And it's an amazing story because his life improved. He got out of bed, he had much more higher quality of life. He now attends the Healthy Aging Memory Club at Mission, Armenia.
How old a man is he?
He's 83. But the daughter thought that he was going blind because of dementia. But he had never had a workup for dementia. They had no idea where to go. So he's got some kind of cognitive impairment going on. He will be, he's had the first steps of seeing a very good neurologist in Yerevan. So, more than likely it's a probable Alzheimer's. But the quality of life has improved and the cognition improved greatly.
This is amazing.
It's a really cool, awesome story.
Yeah, I was wondering what the real affiliation with the Eye Care Project was.
That's it.
Were you just, going along for the ride because you had the truck and
No.
you could just serve more people, but
Exactly.
there's cause and effect here.
That's correct. That's correct.
Because you're trying to do the ICARE project.
We follow them. We follow
That's a
them.
good idea.
Yeah. We follow them around. Yes, we do. And, you know, we're hopeful that we'll continue to do, you know, to start phase 2 in the fall. And work toward, we're developing this in-home care program because there's more hamlets. There's many, many more hamlets.
Yeah.
Last week, I received a call from an American, Armenian young man who's caring for his mother in Armenia, and he had no idea where to turn to. No idea. And she is now in the late stages of the disease. So my team went out and to evaluate, and she's not even taking any medications. There was no treatment. She's not under any treatment. So we were able to connect her up with one of the psychiatrists that does a lot of work at the Avon Mental Health Clinic, Dr. Mahakian, who is also a consultant on our team. And she is now under his care.
Do you know anything about the schedule, the ICARE project? Management was we published publicly? When you're in Armenia, do you wait until this list of sites to be visited is published, made public?
What we do, that's a good point. We have a schedule, a weekly schedule where they will be. And then we coordinate with our team, with their team, and then we meet them wherever they are. That's how it works. We don't know if 100 people will come, or 25 people, or 50, but it's been tremendous. And only one person this last year has said, I do not want my memory screened. And my psychologist said, why? And he said, because I can find my way home, I don't need it. When I can't find my way home, then I will take the memory test. Everybody else has wanted to have their memory screened. Everybody, which to me, that's one of the lessons learned, is I thought there would be a lot of resistance. But our funder, Davos Alzheimer's Collaborative, is thrilled that this project has been so incredibly successful and that we haven't met resistance. If anything, we've, you know, people want it. People want to be screened. It's interesting.
How do they advertise ICARE projects pending site visits? They're making that decision. But I'm, let's say, a village office, I'm somewhere close to the auxiliary border. And if I were to have a transportation ahead of time arranged and know exactly where the next stop is going to be, maybe I have to travel there and wait until the truck over shows up.
They distribute announcements in clinics and in hospitals, so they know where the patients know when the truck is coming. They have amazing way to let people know in that village when they'll be there and what time, and then they arrive. It's really something.
So the news spreads like wildfire.
Yeah, correct. Correct.
That's for the family.
Yes, it does. Yes, it does. Exactly. Exactly. So it's been quite a journey, but it's only beginning.
Yeah.
You know, this project has just literally put the dementia on the map in the
It's
country.
really exciting. It's going on, yeah.
No, thank you,
Very
sir.
important, so important.
Sure. Well, we're the Alzheimer's Association of Armenia. That's who we are. We were very fortunate to be granted full membership in Alzheimer's Disease International. And so we're representing Armenia. Only one organization from each country is allowed to be a member of this association. So it's quite an honor to be part of that. Yeah, thank you. So thank you very much. Thank you.